Welcome. This is the bed model top of Tassinari Bilance. It's a bed and it's also a scale. We can start from the base. You can see there are 4 wheels. They are twin wheels. They are locked by a brake. The brake is in 3 positions. This one is totally locked. This one is all the wheels free. And this one is a one-directional wheel for the transport of the patient. You can see the chassis is made of carbon steel, and other parts are covered by ABS panels. You can see there are 2 big actuators. They are columns. They let the bed go down and up. Here we have the bed net. The bed net is completely made of ABS. It's completely interchangeable. You can take it off for cleaning and everything else. All the panels of the bed can be put away. There are in this bed 2 side rails. Easy to work. And very important, they have all the securities of the last generation bed. You cannot hurt your fingers in all the position. The side rails are completely interchangeable, so you can take away and put from bed to bed. The bed net has 2 consoles for the movements. This one is for in use of the patient and can make many movements. And the personal has this one that is a more complete console. You can have a lot of movements. You can have the backrest up and down. You can have the leg rest up and down. This is very important because this bed has 2 movements of translation. So when you put the backrest up, in the same time it goes on the back. And even the leg rest, when you put it up, it goes in that direction. This is very important for the patient because in the back it doesn't press the stomach and he is free to breathe. And even in the leg rest, it's very important for the leg for a correct movement. You can have also a manual movement of the leg rest, and very important, you have an emergency. You have an emergency lever for emergency movement for the backrest. This is very important in case of emergency. By this side, you can control many movements of the bed. As I say, there is the back rest, the leg rest. You can go up and down. This is very important because the size of the patients is always different. So it's very important having a minimal high, very low, in order to allow the patient an easy access of the bed. And this is about 40 centimeters. This is very low. And you can have also a maximum high that is very important for the personnel of the hospital. They can put on the patient, and it's easy to work with the back in the right position. You don't have to vent your back or your shoulder. This is very important. Then we have a Trendelenburg position. This is very important because it lets go the blood go to the head of the patient. It's very important in an emergency situation. And also you have a reverse Trendelenburg to let the blood go on the leg zone. You can see. You can also have an emergency position of Trendelenburg with all the movements, with all the parts of the bed, of the net, of the bed on the lower position. And this is a real emergency movement. Or you can also have the all down position. This is very important to let the patient go out of the bed. Let's keep on a little higher and let's explain something else. You have also head and footboard made of ABS plastic. They are easy to clean and very easy to change. You can just take it off this lever, put it out without the help of any tools. It's fundamental, without any tools. On the first side of the bed, there are 4 holes for the accessories. They are completely interchangeable. For example, this one is for the bag of blood, but anyway, it can be a lifter of patient lifter. You can put something to bring a monitor. You can have many accessories, and they are completely interchangeable in the 4 corners. All the white part you see on the bed, all the white steel parts of the bed are not just painted, but they are covered by a special treatment. It's an antibacterial treatment. It's based on the ions of silver, and it eliminates the proliferation and the creation of the bacteria. It's very important because sometimes can happen that it's not easy to clean all over the bed. And so it's very important having this treatment because it doesn't allow the proliferation of the microbes. Now we talk about the weighing system. The weighing system is composed about 4 sensors. They are called load cells. In the 4 corners, they are made of aluminum, waterproof, and they are fully certified. The weighing system lets everybody knows the weight of the patient on the bed in all the position. It works in all the position of the bed, low, high, with the backrest up, the leg rest up, and with the patient put in all the nets of the bed. So it works perfectly everywhere. Let's talk about the weighing instrument. Here we have a completely weighing system. It's composed of 4 load cells in the 4 corners, made of aluminum and fully certified. And the weighing system is inside the bed. You don't see the difference between a bed without the weighing system. You have the patient of the bed, and it works with all the position of the bed, Trendelenburg versus Trendelenburg, backrest, leg rest, up and down, and with the patient sit in all the part of the bed net. With the on bottom, you turn it on, and it's on 0. Let's add the weight of the patient. You can see exactly 20 kilograms. It is 20 kilograms in all the 4 corners of the bed. And you can have many functions of the bed. For example, this weighing instrument has a completely programmed software for the dialysis. Very important function of this weighing indicator is that you can add or take off some weight from the bed without change the position of the patient. For example, if the patient feels cold and he needs a cover, you just have to push the bottom 4. It's 5 kilograms, and then push the bottom there. It's always 20 kilograms. And it can also be done in the opposite. For example, if the patient has a pillow and it would like to take off the pillow from the bed, you just have to push the bottom 4. Take off the pillow. it was 5 kilograms. And push the bottom there. And the weight is always 20 kilograms. Or, for example, it's very important to know exactly where the patient is. For example, if the nurse is not looking at the bed, you can put an alarm concerning the weight of the patient. For example, if the weight of the patient is 20 kilograms, you can put a minimum weight, for example, can be 19 kilograms, and then press enter. A maximum weight, for example, 21 kilograms, and then press enter. And now everything changed from the weight of the patient is an alarm. For example, if the patient puts some weight on the bed, alarm. Same thing if the patient tries to go down from the bed and the weight decreases. Alarm. This is a bed, but it can be also a chair. It's very important if there is somebody that goes to the hospital and visits the patient doesn't have to stay in the horizontal position. It can also be put like a chair position. This is very important because if we talk psychologically about the patient, this let him think about a visit to the parents. He's not a patient. He's a person like the others in the room, just sit and talk. A very important thing of this kind of bed is that you have two consoles, one in use of the patient and one in use of the personnel. This one is more complete, as you can see. And it's very important because from this console, you can lock some movement from this, because sometimes the patient tries to move the beds in an incorrect position. And with this one, you can lock his console. So you lock here, and he cannot move the bed by his console. This is very important.